been a technology-driven company, but not only
a convertible system. It's led and driven by surgeon thought and smart.
Bigger and smaller tips so that
to see the direction of the company and the direction of the industry in general, and to see where shoulder replacement's going.
This is the 11th master's course in shoulder arthroplasty that Exactech has supported and presented. It's the first time in 3 years that we've been together. Last year was kind of a virtual meeting, and of course in 2020 we didn't have any at all. So I think the enthusiasm for this meeting has always been there, but it's even more so this year, because people have an opportunity to be together, to interact, to discuss all different aspects of shoulder arthroplasty within a program, an academic program that is truly stupendous, right? Every different topic within shoulder arthroplasty, from the simplest cases to the most complex cases, are being covered, from standard technology to the newest technology to anticipated technology is being developed. The speakers are outstanding. The audience participation has been incredibly impressive. And this is truly an international course. We have orthopedic surgeons from all over the world participating. As a result, right, it's an outstanding academic experience. Physicians and orthopedic surgeons have to be committed to lifelong learning. When you finish your residency or fellowship, you're not finished learning. I've been in practice 38 years. I don't do things anywhere like I used to do it when I finished my training. I don't do it even the same as I did it 10 years ago. Courses like this allow us to participate in lifelong learning, to learn how to do things better, to refine what we do, because the ultimate benefactors of this ultimately are the patients we care for. If we leave a meeting like this, and I'm sure we will leave this meeting, with better ways to take care of our patients, they will be the true winners. Things are probably different within each country with respect to the expectations of the patients. I see 70 or 80-year-old patients or older that they want to maintain their lifestyle, their quality of life, and to them, age is not a factor. So from my perspective, healthcare should be delivered to those that seek it, those that want it. So if I see a patient who's 92 with a severely arthritic shoulder, and I see a patient who's 62 with a severely arthritic shoulder, I am going to offer them the best treatment option that I can. It will be up to the patient to make their decision of how they want to proceed. So I don't think age is a critically important factor, in the sense that it doesn't exclude anybody. It has to be considered, but most importantly, you have to develop the best treatment plan for each individual patient. Europe has a very different healthcare system than the United States. In some ways, in some countries, it's better than in the United States because everybody has access to healthcare. In the United States, that's not true. However, within the context of every country, and for every orthopedic surgeon, we're committed to the same thing, providing care for patients, whether it be for shoulder problems and shoulder arthroplasty, trauma, hip and knee arthritis. That's the common thread, the care of patients. And that is the same regardless of what area of the world you're in, what country you're in, right, or what part of any individual country. So as you get older, and I'm getting older, all right, you have a tendency to look back, right, but you still look forward. So what I want to do in the remaining years of my career, right, is to do what I enjoy most, right, and that is providing care for patients, providing education. At NYU, we have the largest orthopedic residency program in the United States. That's a very important commitment. Educating other orthopedic surgeons in areas that I consider myself knowledgeable about, right, and doing what's necessary to maintain my quality of life, both for myself, for my family. That's the way I hope to finish it.